So, I understand you've come in with a problem in your eye. Which eye is it?
My left eye.
What kind of issues are you having?
It's just quite blurry. In the past few months, I'd say my vision's got worse.
Is it just in that one eye?
Yeah.
Okay.
It's in both, but more in my left eye.
Okay, I'll have a look at it then. When was the last time you had an eye check?
A couple of years ago, maybe.
That's too long. Do you wear glasses?
Yes.
Okay, this one.
Mhm.
Alright, well, I'll ask you some questions, then I'll have a little look in your eye, and we'll probably use the Slit lamp, which is that thing there. Just pop your chin in it, and then get a good look at what's going on at the back. That's okay? Alright, just a few questions first. Have you experienced any blurred vision in it?
Yes.
Okay. Double vision, so this is where you see an object and you see two of them.
Yeah.
Okay. When you wear your glasses, is it for reading or driving or like close up or at distance?
Mainly reading, or if I'm working on my computer.
Okay. Do you know what your prescription is?
No idea.
That's fine. Any blind spots other than your natural one, which is about here? So, sort of tunnel vision, like not being able to see in your peripheral?
No.
Okay, that's fine. Is your health generally okay outside of that? Like, no headaches, nausea, vomiting, insomnia?
No.
Okay. And any difficulty seeing objects you would usually be able to perceive quite easily?
Mainly things from a distance, so...
Signposts?
Yeah.
Do you drive?
Yeah, registration plates, that sort of thing.
That makes sense. And this bit's about colours and your colour perception. Does anything appear desaturated or overly saturated, so sort of brighter and more vivid than it would usually be?
No.
Okay, that's good. And you're not colourblind?
No.
Good, okay. And anything that might have caused it, like any bumps or falls or sort of physical incidents that could have sparked it?
No, just working more on my computer, maybe.
You spend a lot of time close up on a screen? Yeah, makes sense. Do you have blue control on it, which is where it takes out blue colours because it's harmful to the back of your eyes?
No.
Allegedly. Okay. I'll take your heart rate if you don't mind. Just check your vitals. Just to make sure that that's okay, which I'm sure it is. Do you have regular checkups with your GP?
Not really.
When was the last time you went to your GP?
A few months ago?
Okay, that's fine. I'm going to find your pulse on your neck and then just count basically, the old-fashioned way. So try and just relax and breathe normally. Okay, so when you rest, pick a rest. This one's fine. Try and just breathe normally and relax. You can elevate your heart rate if you're too stressed. That's fine though, that seems normal. It's about 16, 68 maybe. That's good. Do you exercise regularly? Good. Alright, I'm just going to have a look at your eye. I'll look at both of them, but I'll focus on the one that's effective. I might have to shine a light in it, but just close your eyes for a start if you could. I'm just going to press gently around the area. Just tell me if they feel the same on both sides. Does this feel the same as this? And here and here?
Yeah.
Okay, that's good. Just turn your head that way. And you said no headaches? No hair?
No.
Okay. Fine. And just pop your neck back and clench your jaw. Your lymph nodes feel normal, so sometimes you can have visual disturbances if you've got some kind of infection, but they don't feel like that's the case. I'm just going to press there again. No difference in the affected eye in terms of sensation?
No.
Okay. That's good. Okay. shine a light in your eye. Be a little bit bright, so apologise. If it's really uncomfortable, just let me know, but you might get a reflection on your eye little spot. It's not too bright. If you just move in a little bit, I'm going to come quite close to you, but again, try and just look somewhere past me on the wall, okay? I'm just going to gently pull your eye up as well. Could you just look up? And down. To the left. A bit further. And to the right. And straight back again. And just look into the light if you can. And back of your eye, just look a little bit. Right, I'm going to check this one. Just pick a point behind me. Just look straight ahead if you could, and then gently pull your eye up. If you just move a little bit closer. There we go. Tail looks normal, we don't look red or infected. No extra gunk in your eyes, or anything like that. Just look up. And down. Sorry. To the right. And to the left. Back to the centre. Okay. Just going to use a pad on now. And just, if you could hold this and cover the non-affected eye. And then just keep your head very still. I'm going to swap out for this light, it's a little bit brighter. Okay, just again, keeping your head still, and then with this eye, just follow the light, okay? And don't move your head. Any irritation when you do that?
No.
Okay, that's good. And now focus on my finger in the foreground and the light. Back to my finger and the light. Good, switch eyes. Okay, again focusing on the light, I'm just going to move it in H pattern and check that your tracking is good, which it is. Okay, now, so just give me the paddle a second. Alright, look straight ahead. I'm just going to check that the reaction in your pupil is consensually dilating, which it is. Just place your hand between, like a barrier, very good. Sorry, just like look at my head, go straight ahead. Consensual response looks fine. Direct response looks fine. Same again. Just keep your hand there. Pupil dilates on direct response, and consensual looks good, okay. Quickly just going to check your peripheral vision now. So just look here. I'm going to move this out of your peripheral. Just let me know when it disappears, okay? So just look straight ahead. And just let me know when it leaves your peripheral.
Yeah.
About here? Okay. And when it reappears?
Yeah.
Okay, same down here. Okay, so this side. Just looking straight ahead. Again, just let me know when it leaves your peripheral, right? So I'm going to start here. Just move it out.
Yeah.
It's about equal distance, that's fine. And when it reverts?
Yeah.
Okay, good. It looks a little bit red, but nothing sort of serious. I'm going to pop you on here and then get a proper look at the back of your eye. It's going to shine a light quite brightly into it, but gives you a really good picture of the blood vessels and if there's any inflammation there. Okay, so if you could just pop your chin on here, I'm going to adjust that. Is that reasonably comfy? Okay. This is a slit lamp, and it's just for looking in the back of your eyes to make sure that your retina is healthy.
Okay.
I'm going to take these one by one, and I'm going to give you some instructions. If you could just follow them as I give them.
Mm-hmm.
Again, if you could just look straight forward. Just going to be looking in your left eye now. Blood vessels don't look inflamed. Retina looks normal. If you could just start by looking at my ear here. Okay. And if you could just look up. Okay, and look to your right. A little bit further up. Good, and look to your left. Good. And look down. Again, if you could just look here. And looking up and left. Up and right. Down and left. Okay, that's good. Okay. Blood vessels at the back of your eyes look healthy and normal. They're not inflamed, they're not overly red or agitated. Looks fine. There we go. If you could just look up again. Keep looking up. And left. Just look a little bit higher left. And down. Okay, back to the right. Up a little bit. To the left. And back to the centre. There we go. Just blink a few times. Light's not too bright, is it?
No.
Okay, good. Just going to readjust this for looking in your other eye. Okay, just pop your chin back. And keep. There it is. Again, I'm just going to shine a quite bright light in your eye. If you could just look up and left. Up and right. Down left. Down and right. Okay. Slight astigmatism in this eye, but I'm assuming that's accounted for in your prescription.
Yeah.
Okay. It looks slightly more severe than the last time, but not a huge amount. You wear contacts regularly?
Yeah, I've got dailies.
And you just put them in at the start, take them out at the end? Okay. Do you ever wear your prescription glasses?
Not as much as I should do.
Not even for reading?
Okay.
You might want to wear your glasses a little bit more just to give you guys a chance to recover. Sometimes wearing contacts all day can dry them out. That's better. Just going to raise your chin. Sorry, lower your chin slightly. Just push your chin right up into the holder. Thank you. Okay, good. Just again, ask you to look up. And look left. Look to the right. And down. And down left. Down right. Up and left. And up and right. And just look at this there. Good. That's good. Eyes look a little red, but I'm assuming that's just from tiredness.
Probably.
Do you get enough sleep?
Probably not.
How much do you sleep?
Not enough.
Roughly? A couple of hours a night? 6, 8?
Maybe about 5.
5, that's poor. If your eyes do get a little red, we can give you some mist for that. It's like a spray, goes over your eyes. Just spray it in the morning or in the evening when you're tired. Ideally, get more sleep, but okay, that's good. Like that. Just gonna look in both of your eyes. Just have a little blink. Okay. Just blink a few times. Okay, gonna look at the right eye now. Have you had your blood pressure checked recently?
Not recently, no.
Is it normal?
I think so.
Okay, that's fine.
It might be on the low side.
Yeah, that would make sense actually. Maybe have your blood pressure checked at the end. Nothing severe, but if you could just look at this area if you can. Okay, and again, just looking right. And look left. Look. And down. Good, that's good. And up and left. And just blink. And again. Down and left. Down and right. Back to the centre. That's good. And down. And down and left. Down and right. Last little bit. Same instructions. Just start by looking at my ear. And looking up and left. Good. Looking up and right. Looking down. Down left. Down right. Back to the centre. Blink a few times, just keeping your eyes looking forward. Okay, that's